Welcome back. One of the big efforts in our state's rebound from the pandemic is making sure all corners of the state are taken care of. We have some good news tonight from rural Colorado's hospital system. While dozens of rural hospitals across the country have closed, none of Colorado's 43 rural hospitals have gone under. Here's how. The healthcare system in Colorado came up with the Combined Hospital Transfer Center, or CHTC. It's a Colorado collaboration among the rural and urban hospitals to transfer patients from one region to another based on the current capacity of a given facility. Now, normally, once rural hospitals fill up, patients are transferred to a hospital in the city, like Denver or Colorado Springs. But now, it's a two-way street, where rural hospitals are taking in patients from more urban areas.
After an emergency like this, with sustained stress on our healthcare delivery system, recovery is absolutely necessary. And recovery won't be easy, but it can only come through an intentional strategic plan. And our group of hospitals has a clearly defined collaborative statewide strategy for rural healthcare delivery that is primarily focused on the building of the capacities of transformational leaders in our hospitals and clinics.
This has enabled Colorado's rural hospital system to survive the pandemic, despite projected losses of $3 to $4 billion in revenue, as well as increased expenses. Thanks to the federal Paycheck Protection Program, rural hospitals and healthcare centers in places like Yuma, Sterling, and Gunnison were able to receive $1 to $5 million. That gave those healthcare centers some much-needed wiggle room to operate.
Those interventions ensured that all of our hospitals stayed open in providing critical services to rural Coloradans. That said, the public health emergency is forcing them and really forcing us into new frontiers around the redesign of healthcare delivery, analyzing what really is necessary moving forward in a post-pandemic world. And that includes virtual care, the reallocation of space, even some payment transformation, how things are paid for. But I would say that our congressional delegation stepped in a huge way. And we don't have a hospital closure in Colorado as a result of COVID.
The CHTC can be reactivated at a moment's notice should another wave of COVID-19 or another public health emergency happen. State officials believe rural health care after this pandemic has its best days coming. You can read the full story on why rural hospitals in Colorado are faring better than expected right now on the front page of thedenverchannel.com.